Thank you for watching the animation. This is YouTube Medical University, suddenly, but have you ever heard of glutathione, also known as Kama or Magmit? Have you ever heard of this supplement? If you've ever gone to the hospital for constipation, I think many of you will recognize that white medicine. In fact, it's a very well-known medicine that you can now easily buy at pharmacies. In fact, in Japan, it's estimated that about 12.15 million people are taking this medicine by prescription, and the number of prescriptions per year is around 140 million. It's said that the number of prescriptions is about 14 times the population of Japan. Recently, a patient in their 70s visited from out of town. They had suffered from chronic constipation for years and had been self-managing the condition. They had been taking over-the-counter acidifying magnesium supplements. One day, they suddenly felt unwell and collapsed, so they came to see me. When I examined them, I found that the magnesium level in their blood was abnormally high, which is a dangerous condition called hypermagnesemia. Fortunately, they were immediately hospitalized, received an intravenous drip, and naturally, the magnesium level dropped, but they recovered without issues. However, continuing the medication without intervention could have led to a dangerous situation. If things had gone just a little differently, there was a possibility that they could have developed a consciousness disorder where their awareness would have become very cloudy. If you leave constipation untreated, your stomach can start to hurt, and in some cases, the stool can cause a blockage in the intestines. When that happens, your abdomen becomes more and more distended, and it can become a life-threatening situation that requires surgery. In fact, I've had patients who came to my outpatient clinic who needed surgery because constipation was the cause. So this time, I'd like to talk about the dangerous side effects of this commonly used medicine called acid magnesium, or magnesium, which is often prescribed. If you experience symptoms like nausea, feeling weak, not being able to get enough sleep, or feeling unsteady when standing up, there is a possibility that these could be side effects of magnesium oxide. Of course, if you can use this medicine properly, it's a good drug, and I often prescribe it myself. That's why it's important to know about the dangerous side effects and use this medicine wisely. This time, in the first part, I'll explain what exactly magnesium oxide is and whether it's really a safe medicine. In the second part, I'll introduce 4 side effects of magnesium oxide that you need to be careful about. Then, in the third part, I'll show you how to use magnesium oxide effectively to relieve constipation. And finally, in the fourth part, learn how to relieve constipation without medicine through recommended foods and exercises. Discover the differences between magnesium oxide and other laxatives, important side effects, and safe usage. Find out how to alleviate constipation without relying on medication by watching this video until the end. On YouTube Medical University, we share information that can help you become healthier starting tomorrow. We provide practical advice on everyday constipation from the perspective of an active physician. If you subscribe to the channel so you don't miss any new videos, I would really appreciate it. So, for a limited time, I'd like to introduce you to acidified magnesium, which is a type of medicine. Don't just take my word for it. Please watch this to the end. Acidified magnesium comes in these white tablets, and sometimes it's also available as a white powder. Its chemical formula is written as MgO when acidified. This is called magnesium. When you hear the word magnesium, you might not immediately think that it works for constipation. Some people might even wonder if it's a dangerous metal or something. So how does this medicine actually work? In fact, there are 2 main types of constipation. The first type is stimulant laxatives, and the second type is non-stimulant laxatives. The first type, stimulant laxatives. Simply put, these are medicines that give instructions to your intestines to move. Medicines like Senna, which are commonly sold, fall into this category. Medicines like Colac also contain these kinds of ingredients. These medicines stimulate the movement of the intestines, especially the colon, making them more active and thereby improving bowel movements. Medicines have the advantage of working relatively fast. After taking them, your intestines stop moving, allowing you to have a bowel movement soon, which is convenient. These are medicines, but for some people, their intestines may become too active, causing stomach pain. Also, if you keep using them as a remedy, your body can develop a tolerance, and eventually, even if you take the medicine, your intestines won't move at all, and the medicine won't work. It's like forcing your intestines to move unnaturally. Another type is called non-stimulant laxatives. These don't stimulate the intestines to move, but rather, they simply soften the stool. Actually, acidified magnesium is also classified as this type. Others are called polyethylene glycol, for example. There are also medicines like Movicol, Ametisa, linaclotide, and Linces. It's a bit complicated, but these new medicines are also classified as this type. Compared to the stimulant laxatives, these medicines work in a milder way. These medicines soften your stool and allow natural bowel movements, resulting in fewer side effects like abdominal pain. The choice between non-stimulant and stimulant laxatives depends on your specific issue. For hard stool, non-stimulant laxatives are recommended. If your stool is normal, but you have constipation due to bowel inactivity, stimulant laxatives may be suitable. Sometimes both types are used together. The diagram shows acidified magnesium. When you take tablets or powder, they pass through your stomach and then the duodenum, where they react with digestive enzymes and other substances and change into compounds like magnesium bicarbonate or magnesium carbonate. These substances then, one of its main characteristics is that it draws water into the intestines. So when you take this acidified magnesium, water gradually gathers in your intestines, making hard stool softer and easier to pass. This is the unique feature of acidified magnesium. But that's not the only advantage. It has a long history as a medicine, and compared to other drugs, it's relatively inexpensive. For example, a typical dose of 330 milligrams costs about 5 or 6 yen per tablet. Even if you take 2 tablets a day for a month, the cost is only about 300 yen per month. It costs a few hundred yen and allows for easy dosage adjustment. If one tablet is ineffective, you can take 2 or more. If 2 tablets don't work, you can take up to 4 tablets.
It's said that this medicine doesn't cause tolerance, which is another advantage. That's why Dr. Taku prescribes this medicine. In Japan, the rate of constipation is said to be about 2.5% for men and 4.6% for women.
Constipation is more common among elderly women. Around 10% of people have used this medication, and it's common to combine it with other constipation treatments. However, it's not always beneficial and can cause side effects that require caution. To achieve the best results, it's crucial to study properly and use the medicine correctly in combination with other treatments. Reviewing the basics is key. Acidifying magnesium draws water from the stool and helps to soften it. This non-stimulant laxative naturally promotes bowel movements by softening stool without directly stimulating the intestines. It's a good medicine despite the low price. So, let me introduce 4 dangerous side effects of acidifying magnesium that you might regret not knowing sooner. The first of the 4 dangerous side effects of acidifying magnesium is hypermagnesemia. As the name suggests, acidifying magnesium contains the mineral magnesium, and if this accumulates in the body, it can lead to hypermagnesemia, which means high levels of magnesium in the blood. Symptoms can appear. Specifically, symptoms include nausea, vomiting, feeling weak, decreased muscle strength, drowsiness, and in severe cases, even coma. When we talk about adrenal insufficiency, symptoms like feeling weak, having trouble standing up, or feeling dizzy can appear. You might feel like your body is heavy or sluggish. Recently, Ms. A woman in her 70s, told me, "My body just doesn't feel as strong as it used to and I get tired easily. Maybe it's just because I'm getting older." At first glance, it seemed like her symptoms could be due to aging, but when I examined her, her magnesium levels were high. Normally, when you take this acidified magnesium by mouth, most of it is excreted in your urine, or if it's absorbed into your blood, your kidneys filter it out and you excrete it. However, what you really need to pay attention to is if your kidneys aren't working well. People with chronic kidney disease or kidney failure have trouble removing waste minerals from their bodies, so magnesium can build up in the body. Also, as people get older and their kidney function declines, magnesium tends to build up more easily. Of course, if you increase your daily intake of magnesium, the risk of developing high magnesium levels in your blood also increases. So people with weak kidneys, the elderly, and those taking large amounts should be especially careful. If your magnesium level gets too high, you may become less alert, your blood pressure may drop, or your breathing may become shallow. In the worst case, your heart could stop or become irregular, which can be fatal. Changes in the heart can occur, so for those who are at higher risk, it's important to have your blood tested regularly at the hospital to check if your magnesium levels are not getting too high. It's necessary. Just because a medicine is sold over the counter doesn't mean it's completely safe, so please be careful. If you're worried, consult with your local hospital or an internal medicine doctor. Combining multiple over-the-counter medicines without knowing potential side effects can lead to regrets later. In fact, this antacid magnesium medicine, depending on what other medicines you take with it, can weaken the effect of those medicines, or on the contrary, increase the risk of side effects from other medicines. Taking magnesium oxide with prescribed antibiotics for infections like pneumonia can reduce the antibiotic's effectiveness, preventing improvement. This can actually happen. Magnesium oxide is also used for conditions like osteoporosis, which weakens the bones. The medicine's absorption is impaired, reducing its efficacy. It can weaken the effect of thyroid hormone medication, and for people taking iron supplements for anemia, it can also reduce the absorption of those medicines, among other things. There are some important points to keep in mind. For example, you should be careful about taking milk or dairy products, which you usually consume, together with antacid magnesium at the same time. The reason is that taking magnesium together can increase the risk of hypercalcemia, which is a condition where calcium levels in the blood become too high. If calcium levels get too high, it can cause symptoms such as muscle weakness, drowsiness, and other various symptoms. On the other hand, there are also medicines whose effects are reduced by antacid magnesium. These are stomach medicines. If you have listened to the previous explanation, you probably understand this well. Right, this antacid magnesium reacts with stomach acid. If you take this antacid magnesium together with stomach medicines that suppress stomach acid, the antacid magnesium can't react with the stomach acid, so the medicine doesn't work well and constipation doesn't get resolved at all. As a result, you might end up taking more and more medicine. This is something that often happens to us as well. These are things that medical professionals should be careful about, but they can unexpectedly forget about them. If a patient's medication from another hospital isn't communicated to us, we might prescribe medicine without knowing, leading to potential issues. Using a medication notebook or similar tool is crucial to prevent this. If you can ask your doctor at the hospital or the pharmacist at the pharmacy or consult with them without hesitation, that would be ideal. Searching for your medication online or reading the information leaflet can reveal important details about side effects and drug interactions. Take the time to study this information carefully. After watching this video, please check the summary section for more detailed information. There are 4 major dangerous side effects that you might regret not knowing about. One of them is diarrhea. Since this medicine softens the stool, it's understandable that it can cause diarrhea if it works too well. However, in reality, many people start taking this medicine and end up having diarrhea so frequently that it becomes difficult to go to work or do their daily activities. Many people stop taking their medication because it interferes with their work or daily life, or they simply don't want to use it anymore. This is common sometimes if the dosage is too high for the person's body weight, or if they have a sensitive constitution, the medicine can be too potent. Some people might think that diarrhea is still better than constipation, but if this diarrhea continues, it's not just about having loose stools. The fluids from your intestines are being lost from your body. When these intestinal fluids are lost, it increases the risk of dehydration and can cause other problems as well. Since minerals are included, losing them can lower your calcium and sodium levels, which can cause various health problems. You might also experience symptoms like muscle cramps or pain. That's why it's very important to start taking this magnesium laxative with a small dose and adjust it gradually. If it's an over-the-counter medicine, start with a small amount, like 1 tablet a day, and if you don't feel any effect, gradually increase the dose. Even with hospital prescriptions, I adjust dosages for patients who can handle it and let them make adjustments too. It's fine, for example, to give the medication separately so they can take it as needed. I'm trying different things. If you can use it skillfully, it's a good medicine. But if it works too strongly or doesn't suit you, please try to find the right dosage for yourself. If you don't know, you might regret it later. The 4th and final dangerous side effect is constipation. Constipation means your bowels stop moving, which is a serious risk. Let me say first, this is actually quite rare, but constipation, a stopped bowel, bowel obstruction, or in the worst case, a hole opening in the bowel can happen. Why does this occur? When we talk about risks, for example, people who are already constipated and have hard stools are at higher risk. For these people, taking magnesium oxide draws water into the intestines. Even if the stool is hard and large, some water is drawn in, making the stool itself bigger. If the stool gets too big in certain parts, it can completely block the intestines and cause a bowel obstruction. In the worst case, the intestine can rupture from that point. This increases the risk. So, if you suddenly start taking a medicine like magnesium oxide for constipation and you experience sudden stomach pain, can't pass stool at all, feel nauseous, or actually start vomiting, it means your intestines might be completely blocked. This may also occur, so consult a hospital immediately. That concludes the serious side effects and risks of magnesium oxide. So, to summarize the 4 main points. First, there is the risk of hypermagnesemia, which can cause symptoms like drowsiness, lack of energy, slow reflexes, and muscle weakness. Second, depending on how you take the medicine, it may not work as intended, or the magnesium oxide itself may not be effective, or on the contrary, too much calcium may be absorbed. Third, diarrhea. If the medicine works too strongly, it can cause diarrhea, dehydration, or painful bowel movements. And finally, the fourth risk is intestinal obstruction, where a blockage forms in the intestines. I have introduced these side effects in this way at YouTube Medical University. We share important and easy to understand information from the perspective of practicing doctors, so you can become healthier starting tomorrow. We provide information from a doctor's point of view. Our social media is also very active. There is a lot of information out there, but some of it is incorrect. So that you don't regret trusting the wrong information, it's important to have at least one reliable source of information. If you like, please subscribe to our channel and don't miss our new videos. We'd be happy if you do. Now, within the time we have, I'd like to introduce how to use this acid magnesium effectively. Based on my own experience, there are mainly 4 key points to using acid magnesium well. The first one, as I mentioned earlier, is to start with a small amount. For those starting medication for constipation, I recommend acid magnesium. Start with a small amount to avoid unexpectedly strong effects. Please also refer to the attached documents for more information. If using over-the-counter medicine with instructions to take 1 tablet daily, it's best to start with the minimum amount. Some find 1 tablet too strong, so they begin with half a tablet. Some people are more sensitive, so please use this as a reference. If it works well for you, you can stick with that amount. If it doesn't work enough, you can gradually increase the dose. Some people take 1.5 tablets, while others take half a tablet for a milder effect. Fine-tuning dosage is possible with medicine. Many are unaware that a second dose can be effective. The effectiveness and speed of this acid magnesium medicine varies based on timing. It is often prescribed before meals or bed because if taken after eating, it works immediately. As it's a mild medicine, taking it before bed won't suddenly cause stomach pain or other issues. Taking it before bed will gently soften your stool in your stomach. Taking it before bed softens stool by morning, making bowel movements easier. It's often prescribed at bedtime. Magnesium oxide may interact with other medicines, reducing their effectiveness. If taking other morning medications, magnesium oxide may be prescribed at a different time, like before bed. Some forget to take it at night and take all medications together in the morning. Be careful, as this can reduce effectiveness. Timing adjustments are crucial. Some take it twice daily, morning and evening, while others take it thrice daily, like before meals, depending on the individual. If taking your medicine at once or the way you're doing it isn't working, consult your pharmacist or doctor about adjusting the timing. Various types of calcium and other medicines need attention to how you take them together. When taking your medicine, use 1 or 2 cups of warm water. Magnesium oxide draws water into the intestines, so if you don't take enough fluids, your stool may not soften as expected. Drink plenty of water when taking it. Note that magnesium oxide may not work for everyone. Additionally, avoid taking this medicine long term, as medicines aren't meant for indefinite use. For constipation, focus on improving diet and lifestyle habits instead of solely relying on medication. Don't rely on magnesium oxide just because your symptoms haven't improved. It's not a complete solution, and you shouldn't use it solely to manage daily life. If you feel it's no longer needed, it's fine to stop. Remember, magnesium oxide has potential side effects, especially as kidney function may decline with age, leading to magnesium buildup. Regular checkups are crucial. It's important to check your magnesium levels and consult with your doctor if you can't stop taking magnesium oxide. In other words, it's a good idea to find a hospital where you can easily consult with your doctor about anything. Also, the fourth and final point is to always let your doctor know if you are taking any other medications or supplements. There are some medicines that you need to be careful about when taking them together, so be sure to mention everything, especially antibiotics and other drugs. Be aware that drug interactions can prevent important medicines, such as those for osteoporosis or stomach issues, from working properly. Vitamin supplements and Chinese herbal medicine can have unexpected side effects or interactions. Inform your doctor about everything you're taking. That's the third key point. When taking acidifying magnesium, start with a small dose and adjust while monitoring stool changes. It's usually taken before bed, but can be taken in the evening, morning, or split into multiple doses, depending on the individual. Timing adjustments can improve results. Also, consult a doctor before continuing use on your own. Be cautious of side effects and avoid excessive doses or improper methods when taking medication. Improving lifestyle habits is crucial. If taking other medications or supplements, exercise extra care and inform your healthcare providers. So, finally, when it comes to improving constipation without relying on medication, what kinds of things should you pay attention to in your daily life? People often say that eating foods high in fiber is good, but what kinds of vegetables are best? What kinds of exercises are effective for relieving constipation? I will explain it simply. The basic principle of treating constipation, as I have mentioned many times, is to improve your lifestyle habits. If you grow accustomed to being constipated and regularly use laxatives, it becomes normal for your bowels to always contain stool. If your constipation symptoms subside or you adapt to them, the condition may worsen without your awareness. Therefore, improving lifestyle habits is crucial, even if you've heard this advice before and doubted its effectiveness. I urge you to listen to today's talk and attempt at least one suggestion. If you're already trying something, please persist with it. Please share your experiences in the comments section. It may be helpful for others as well. Here are 5 lifestyle habits to fundamentally improve constipation. The first is to regulate your bowel movement rhythm. Bowel movements have a rhythm, and many people with good bowel habits tend to have one in the morning, often after breakfast and before using the restroom. To avoid constipation or stomach discomfort during work, it's important to have a morning bowel movement. It's important to be conscious about creating a routine. In fact, right after breakfast is the golden time for bowel movements. This is called the gastrocolic reflex. When you wake up in the morning and your stomach expands, it sends a signal to your intestines to start moving. So if you skip breakfast, your digestive system doesn't get activated and your bowel movement rhythm gets disrupted. It's important to eat breakfast every morning. After that, even just 5 minutes after breakfast is fine, so go to the toilet and check if you feel the urge to have a bowel movement. You don't need to relax and force yourself. Just by paying attention to your stomach, sometimes you might actually feel the urge to go, and your rhythm will become more regular. The second tip for improving constipation is to stay hydrated. For those who are too busy to eat breakfast, at least make sure to drink enough water. It's said that the gastrocolic reflex can be stimulated not only by expanding the stomach with food, but also by taking in water. So please try to do that as well. About 80% of stool is made up of water, so if you don't get enough fluids, your stool will become hard and difficult to pass, which is a big problem. The goal is to drink at least 1 liter of water a day. Try to get that much fluid. Drinks like coffee that contain caffeine. As for tea, it has a diuretic effect, so please set your goal to drink 1 liter of fluids, excluding those kinds of drinks. If your stomach gets cold easily or hurts when it's cold, try drinking warm water or hot water like shiroyu to warm your stomach. This can help stimulate your digestive system. A specific step you can take is to drink a cup of water right after you wake up in the morning. Just by drinking 1 cup in the morning, you can get a good portion of the 1 liter you need for the day. For those who are busy with work, try using a water bottle or something similar to make sure you consciously take in fluids throughout the day. Make it a rule to always have a cup of water with each of your 3 meals. By following these simple rules, you can easily get the necessary amount of water you need each day without overdoing it. The third key point for improving constipation is fermented foods. I'm sure everyone knows that fermented foods are famous for this. Fermented foods are always recommended by health organizations. These fermented foods, when people ask what's so good about them, it's said that there are about 100 trillion bacteria living in our intestines. It's called the gut flora, and it's said that the balance of these intestinal bacteria actually affects things like bowel movements and even the control of bowel rhythm. It's said that increasing good bacteria like lactic acid bacteria and bifidobacteria can help improve constipation. There are several research reports about this. That's why it's recommended to regularly eat fermented foods that help increase these good bacteria, such as kimchi, yogurt, natto, miso, and nukazuki pickles, ideally once a day or with every meal. Please keep in mind that even small amounts are fine. It may not work immediately, but many patients have reported that as their intestinal flora gradually improved, their bowel movements got better. Some find yogurt works better, while others find kimchi more effective, depending on the person. Eating certain foods may not always improve constipation due to individual differences, and in some cases, it may even worsen the condition. Given the limited data, remember that individual experiences may vary. However, I believe it's fine to give it a try and see how it works for you personally. The fourth key point for improving constipation is dietary fiber. However, there is little solid evidence that it definitely improves constipation. Published in 2012, in a highly reliable study called a meta-analysis, it was reported that taking more than 0.35 ounces of dietary fiber per day for about 4 weeks to 1 month increased the frequency of bowel movements and improved stool hardness. Dietary fiber is often said to be good, but there are actually 2 types of dietary fiber. This may be familiar to many of you as it was previously introduced on YouTube Medical University. Dietary fiber comes in two types: water-soluble, which dissolves in water, and insoluble, which doesn't. Consuming both types in a balanced manner is considered important. As the name suggests, water-soluble dietary fiber dissolves in water, becomes gel-like, and softens the stool to help it pass more easily. It has this effect and is said to serve as food for good gut bacteria, expected to help improve intestinal environment. Specifically, foods like sticky seaweed or konjac are examples. Soluble dietary fibers are found in foods like apples, bananas, and oatmeal. In contrast, insoluble dietary fibers increase stool bulk and stimulate intestinal movement. That's the general idea. Foods like gobu, burdock root, kinoko, mushrooms, and brown rice contain insoluble dietary fiber. If you think, I eat a lot of this type of dietary fiber, but not much of that one, try to supplement the one you're lacking and aim for a balanced intake. Eating these foods may improve your constipation, so I encourage everyone to try them and see if it helps. Please let me know in the comments if you experience any improvement with your constipation. The fifth and final tip for improving constipation is light exercise. Many of you may already know this. Similar to drinking water after waking up, taking a walk, or exercising right after getting up is a crucial stimulus for intestinal movement. Since I started taking morning walks with my pet, my bowel movements have improved. Even just 10 or 15 minutes a day is enough. Walking, getting off the train one stop earlier, and walking the remaining distance to work can help improve bowel movements. If you're not into exercising, stretching is fine too. For example, you can do stretches like twisting your waist like this. You can also do movements like radio calisthenics or stretches that extend your abdomen. These kinds of stretches are beneficial too. While driving, you can stretch your abdomen by shaping your stomach like the hiragana character no. It's especially recommended when you feel bloated or relaxed, so be aware of what you can do yourself. This is just my personal opinion regarding bowel movements. I think it's important to pay attention to how your stomach feels. Whether or not you had a bowel movement today, just being aware of it is important. When you're busy, you might not even think about your bowel movements. Many people worry about constipation and its future effects. Next, I'll discuss lifestyle habits that can help improve constipation. To regulate bowel movements, 1. Establish a rhythm. 2. Stay hydrated. 3. Eat fermented foods to improve gut health. And 4. Increase intake of the 2 types of dietary fiber. Also, as the 5th point, I introduced doing light exercise and stretching. Since this has become a long session, please review as many times as you need. And if you have any questions, feel free to go over it again. Also, whether you press the good button or the bad button, your feedback on this video will help improve the next one. Please leave a comment, even a single word about your impressions or a memo. Share your thoughts, whether you want to try this or feel anxious about it. Even just a single word in the comments will encourage me to keep updating the videos. Your comments energize me, so please leave one. See you in the next video. This is Amazon Shibu, a psychiatrist, sharing the best advice for living youthfully from your teens to 70s as taught by my patients. The book became a bestseller in 4 categories and ranked high in gift rankings. As a doctor, I compiled the essential lifestyle and health tips I learned from my patients. It inspires readers to embrace a healthy life. The well-reviewed product is currently on sale, so check it out if interested.